Hi everyone, it's Dr. Chopra. I'm a board certified plastic surgeon here in Minnesota. And as a plastic surgeon doing exclusively cosmetic surgery, I often get phone calls at least once or twice a month from a friend or a family member or even a complete stranger saying that they've got an injury, they need help with figuring out how to prevent it from getting a poor scar after being repaired. This is definitely the type of video you'll want to like it, share it, and save it so that you can reference back to it when a friend or a family member has an issue and they want tips on how to make the scar heal better. So there's a bunch of things you can do to help with scarring, but there are two factors that you cannot control. Number one is the injury or the extent of injury, and the second are your skin type and genetics that influence how you heal. So with respect to the mechanism of injury, there are some injuries that are so extensive or are so contaminated that no matter what you do, it's going to heal with a scar that's unfavorable or may need a revision later. The second is skin type and genetics that play a role. There's some people out there who, no matter what kind of incision they get, they heal quickly. They heal with a flat scar that doesn't pigment or darken. Whereas on the other hand, you have patients who, no matter what kind of a small nick they get, they're going to have a dark spot or a bumpy scar, sometimes referred to as a hypertrophic scar or a keloid. So number one most important thing you can do after an injury to help heal better is get the wound clean. Dirty wounds that are contaminated either with dirt or any other product are going to heal with more inflammation, and inflammation causes more redness and darkness of the incision, but also can increase the chances of infection or tissue loss. So rule number one, get the wound clean before repair or any sort of intervention. Most of these traumatic wounds will also require some form of antibiotics. Okay, so now the wound is clean and you're on antibiotics, what's next? A lot of people ask me if tape such as steri-strips or sutures are required or glue. The truth is, if you have a real incision that has a real cut beyond just the skin, then you're going to require something more than just skin glue or taping. The reason is the skin glue and taping only takes care of the top surface of the wound, leaving all the deeper tissue separated. So as it heals, it's going to create a divot or a depressed scar. And the second thing is it can lead to scar widening as that surface layer, the top layer that you've repaired with glue, starts to pull back onto the support structures below. So in summary, superficial abrasions or nicks, you can cover them with skin glue or a steri-strip, or put it on after the deeper tissues have also been repaired. For everything else, you'll want to use deep sutures, multiple layers for a three-dimensional closure of what's typically a three-dimensional wound. When can I shower? So oftentimes after the first 24 hours, I allow my patients to shower. There is some incisional management that's very important. For the first 2 or 3 days after repairing a wound or an incision, there will be some oozing and crusting. You'll want to clear this off 3 times a day for a maximum of 3 to 4 days using peroxide mixed 50-50 with tap water or normal saline. And just use a Q-tip and gently remove any of the scabs or crust that are on there. But you don't want to do this more than 3 times a day, and you don't need to do it past 3 or 4 days, because after 3 or 4 days, there usually isn't oozing and crusting. So if you're doing this 8 times a day and you're doing it for 3 weeks, you're not helping, you're hurting the incision and preventing good scarring and better healing. The next is to maintain a moist environment for healing. And this is super important for incisions to heal well. I typically like to recommend a plain ointment such as Aquaphor, and if you don't have access to Aquaphor, then just use a plain yellow Vaseline. You don't want to use things like Neosporin unless I've specifically prescribed it, because it can lead to dermatitis, which can be counterproductive due to the inflammation. Next question, so how long do sutures stay in? Sutures in the face typically will want to stay in place 5 to 7 days. Sutures in the breast or body typically need to stay in place 7 to 10 days. Again, this is not really a hard and fast rule, but areas with thin skin and low mobility, you can remove as early as 5 days. Areas like on the arms or legs with high tension, high mobility, thick skin may need to stay as long as 14 days. All right, next topic is, now that you have a healed scar, what can you do? I hear a lot of questions about silicone, so here it is. Once the scar is fully healed, the sutures are removed, there's no areas of openings, the number one thing you can do is to be diligent about the use of silicone and sunscreen. There's a lot of different creams out there. The only one that I would really recommend would be biocornium. Otherwise, just plain silicone sheeting that comes in circles for like a breast nipple area, or sheets or lines. Those are great for a variety of types of incisions, such as under the chin, along the tummy, or even on your arm. I recommend using these twice a day. And how long do you want to use it? Well, you want to use it as long as the pink scar is present. A pink scar means it's still maturing, and therefore the silicone and sunscreen are both very important to ensure that the scar remains as flat as possible and the least amount of pigment as possible. One thing to keep in mind is I'm talking about a pink scar, not spreading pinkness around the incision. Spreading pinkness around the incision accompanied by warmth or tenderness or swelling could signify an infection. So again, this is not a video for medical advice. You'd want to talk to a doctor or a plastic surgeon, but I do want to share a few good details with you. What can we do to speed up healing? A lot of patients will ask about microneedling or lasers. These are energy-assisted therapies that can be helpful with scar maturation. We do want to wait until you're in that optimal phase, which is around 6 to 8 weeks, where there's maximal cellular regeneration and tissue remodeling occurring, where these technologies can definitely play a role in improving the flatness of the scar. And in the case of a pulse dye laser, it could help reduce the redness of the scar. When would we recommend a surgical scar revision? So surgical scar revision is another procedure. It's removing the old scar, repairing the resulting wound, and hoping for a better scar outcome. So this isn't something you want to do right away. You don't want to rush into this, because we want to see at least 6 to 8 months of scar healing to see where you will end up and whether or not a scar revision can offer you an improved scar above and beyond what you already have. If you do end up with a scar revision procedure, it's usually done under local, depending on the area. Again, it's a layered closure, so we recreate a full 3-dimensional defect and we repair it from deep, middle, and superficial. And typically, in the first few months, if needed, we can use steroid injections to help nurse that healing along. But again, that'd be something we'd evaluate together in person. So there you have it, a couple of great tips on how to heal well after an abrasion or an injury or a traumatic accident.